that one day all youth will have the opportunity, motivation. Oh my God, I just blanked.
Welcome to the highly anticipated second series of Kuul Conversations. Thank you for the incredible response to our first series. And we heard your ask, and so we're back for more conversations, where I, Claire McSweeney, founder and CEO of Kuul Play, sit down with thought leaders, change makers, and innovators who share our commitment to building healthy, vibrant communities. These brilliant, forward-thinking people with amazing stories are shaping the future of our children's physical activity, sport, and health. Now, conversations can lift us up, catalyze action, and my hope is that these conversations are meaningful, whether you're a coach, parent, caregiver, educator, or just interested in health, and that they leave something of value with you. So come join us for another series of inspiring and insightful Kuul Conversations. Here's to learning, growing, and moving together. And I'm thrilled to welcome Rachel Fisher and Commander Dr. Katrina Piercy to Kuul Conversations, who as part of the Department of Health and Human Services advance the health of the nation through setting the priorities and translating the science to policy. Rachel Fisher is a registered dietitian who serves as the acting executive director of the President's Council on Sports, Fitness and Nutrition in the Office of Disease Prevention and Health Promotion at the US Department of Health and Human Services. She earned her doctorate in said discipline at the University of Northern Colorado and completed her master's at Tufts University. Rachel previously worked at the National Institute of Health in the Division of Nutrition Research and is a lifelong advocate of physical activity and movement. Commander Dr. Katrina Piercy is also a registered dietitian and a clinical exercise physiologist who serves as the director of the Division of Prevention Science in the Office of Disease Prevention and Health Promotion at the US Department of Health and Human Services. She earned her PhD in said discipline at Virginia Polytech Institute and completed her bachelor's while also competing as a Division I soccer athlete. She leads and executes a number of national policy initiatives which impact the health of all Americans. So welcome, Rachel, Dr. Piercy, Katrina. It is so great to be with you both today. How are you?
Great, thank you. Appreciate you having us.
Yeah, we're excited to be here.
Well, between our schedules, I know it's been some time, but this is a conversation worth waiting for. So I'd like to welcome you to the Kuul Play community and really thank you both for taking the time to be here to share your work, your insights, and particularly the impact that you're both having in our professional field. And you, of course, and your department are the people who set the priorities and translate the science into policy to advance the health of the nation. So this is going to be a fun conversation. And I know in getting to know you both just a little that really what struck me was you both walk the walk. You live and breathe healthy, active lifestyles. And so I'd love to maybe start there. Like, what's shaped you and your journey to becoming national leaders in physical activity, nutrition, and health?
Do you have a preference who starts?
No, whatever you like.
Go ahead,
I can jump in. I think for me, it's always been something that's been very important in my life, just understanding the benefits that I personally feel. And now as a parent, just witnessing the power and the benefits to my kids of living a healthy life and being physically active and how it makes them feel, how it makes me feel, and just the things we can do as a family. And then just, looking around the country and just how important it is anecdotally and from all the data that we have, just about the benefits and just how inspiring that is to me personally.
Yes.
And I would echo everything Rachel just shared. I have 2 young kids, and it's been really fun seeing them start to enjoy activities and enjoy sports. They're 5 and 7. So like just getting into all of the things. And for me, I played soccer my whole childhood and through college. And so I'm coaching my son's soccer team now and getting to watch the joy as he's learning the game and having the benefits of being playing sports and being active is just tremendous.
That's incredible. And what strikes me is that you both in your childhood or growing up had exposure to sports and activity, and you're now the role models for your family and kids. And that seems like such an important component in behaviors and learning and habits for that role modeling piece, would you think?
Absolutely. And that's a lot of what we put into the National Youth Sports Strategy that we put out in 2019. And really, the purpose of that report was to provide a roadmap for how youth sports should look like in our country, with a particular focus on underserved populations who may not have had that opportunity to play. We know most kids, less than 25%, are meeting the physical activity guidelines. So that's 60 minutes each day of moderate intensity physical activity, including 3 days of vigorous activity, muscle strength activity, bone strength activity. So all of the things that kids do naturally and in sports, the running, hopping, skipping, throwing, those are important pieces for them to develop healthy lifestyles and also like the physical literacy skills. But a lot of kids aren't even getting that, and they're not getting the opportunity to play sports. And so part of why we're so passionate about the work we do is that we've seen the benefits ourselves and in our kids. And so how do we allow more kids to have that opportunity to play?
Right, right. And so therefore, like your roles are incredibly important as governmental roles. And I suppose for today's conversation, we'll focus a lot on that physical activity component. I know you cover much broader than that. So maybe let's dive into, for our listeners who may not be familiar with specifically the work you do. Maybe Rachel, could you help us understand your work in this space?
Sure. So I'm currently serving as the acting executive director for the President's Council on Sports, Fitness, and Nutrition. And that is a federal advisory committee that the mission is to engage, to empower, and to educate all individuals living in America about living a healthy lifestyle that includes physical activity as well as good nutrition. And this President's Council has been around since the 1950s. And so it has a very strong and historical legacy of just really being there to empower Americans. And we support it through the Office of Disease Prevention and Health Promotion, which is in the Department of Health and Human Services. So that's where I physically sit in the federal government and oversee that committee, which is the members of that committee are appointed by the President of the United States. So we currently have 29 members that have been appointed, and they represent a very diverse background of individuals, athletes, coaches, experts in the field of science, and that, spanning both nutrition and physical activity, humanitarians, chefs, and individuals with lived experience. So they bring that perspective from all disciplines and to really be able to amplify the messages that come out of the federal government. And I can let Katrina talk a little bit more about holistically kind of what our office does at the Office of Disease Prevention and Health Promotion. But my role is working with the council and really helping to advance the translation of the science into this communication vehicle.
Wow. That's really, really powerful. And Katrina, then on your side?
Sure. So this is where everything dovetails together really nicely. So I'm the director of the Division of Prevention Science in the Office of Disease Prevention and Health Promotion. So our team oversees the development and implementation of national policy. On one side, we do the dietary guidelines for Americans in close collaboration with USDA. On the other side, we're doing physical activity policy development. So that's the physical activity guidelines for Americans. We just released in June a mid-course report on interventions to increase physical activity among older adults. And then the National Youth Sports Strategy as well. And so all of these policy pieces of like, here's the science, here's what we know can help someone have a healthy lifestyle, then feed in perfectly well with the President's Council, because we've got these higher profile individuals that have different platforms and different groups that their messages may resonate with. And so it's a great synergy. The Office of the President's Council on Sports, Fitness, and Nutrition used to actually be a separate office, but worked closely with us. And a few years ago, they brought everybody together with the idea that we could have more synergy and alignment to be able to share this important work.
That's incredible to amplify the work and the impacts that you're having. And so maybe, like, if we were to take a step back, one might ask, what are the drivers behind this? Why do we need it at all? How do we get to this point?
We see a really important role when you ask about the drivers and why do we do this. So we're in the space of public health and public service. I'm in the public health service, hence why I'm in uniform. But we really see our role is to take a look at this massive volume of science and try to synthesize that down. And so Rachel mentioned that the President's Council is a federal advisory committee. And anytime we develop national policy, we engage a federal advisory committee. So for the dietary guidelines, physical activity guidelines, that's bringing in academic experts at the top of their field to help us synthesize the science. So we're in that process right now. The 2025 Dietary Guidelines Advisory Committee is meeting now. Their third meeting is coming up in September, but they will work over the course of 2 years to really look at that science, make recommendations to the government, and then it's our role to develop the policy. And we see that as an important piece to be able to give to the public and really to health professionals to say, here's what we know. Here's the amounts and types of physical activity that can lead to these health outcomes. Here's the type of healthy food patterns that lead to these health outcomes or reduce your risk for this piece. That's really our role because the volume is huge. And every year there's more publications, there's more literature, and trying to kind of be able to go through and say, what is the science of this? And that's the underpinning of all of the work that comes out of our office is what's the science and what do we know and what are the gaps that we might hope to fill in the future.
And then, building off of that, so the President's Council can advise the President through the Secretary of the Department of Health and Human Services on opportunities to take those policy documents and the guidance that we have into the community. So they're looking at strategies to help communicate it and advise on opportunities, whether it be at the state, national, local, or tribal level.
That's incredible. And what really strikes me here is in the age of mass amounts of information at our fingertips, what's really resonating is it's the science. You're taking the best available science. You are the holders of that. And so for people to go, they know they can come and go to you and it's communicated through you, but you are the holders of that. It's the best available evidence we have at a current time on all the different areas. And I think that's so vital in an age where we have so much misinformation. And I think it's a very important point. It's evidence-based, it's based on the best science, and you are the experts in this area. And so just building off of that, then I think about the age of information that we're in. I'm wondering, do you have any thoughts around, is it challenging for this if we're awash with so much messaging around physical activity and we can sometimes popularize maybe inaccurate messages? I'm sure you can think of some. Do you have any recommendations for people to help sort through that noise?
Sure. So one of the things that we try to do is develop maybe messages for different types of people that are going to digest that information. So for example, there's a few layers before we get to actually the federal policy. The advisory committee does their work and they compile a scientific advisory committee report. It's a very technical scientific report. It's written for dietary guidelines for the secretaries of HHS and USDA. On the physical activity side, it's going to the secretary of HHS and really going to the federal government to use that scientific piece to write the policy document. The policy documents we write are then for health professionals, for those that are going to help translate that piece. And then we take it a step further. So for the physical activity guidelines, we have our Move Your Way communications campaign. And that's the translational piece where we really try to take the science and unpack it because it's a lot of information. I have a PhD in exercise physiology, so I can unpack in those pieces, but the general consumer is like 150 minutes. Where do I start? Like that is a big number. And so we use Move Your Way to take the guidelines and really make them into more digestible pieces. And so one intentional piece that we do is around the messaging and how we talk about activity. And we intentionally use the word physical activity and not exercise. So we know when people think about exercise and they hear that, the main images that are conjured up are kind of sweating and the correct equipment or shoes or outfit, or that you're in a gym or in a specific location. And for many people, that can be a turnoff, and that doesn't sound fun. It sounds hard. You're sweating, and so we like to talk about physical activity. So that movement piece, and that can happen at home. It could be a dance party with your kids. It could be a walk around the park or the neighborhood. It could be doing chores. It could be vacuuming. And so thinking about how do we talk to people about the activity that they need, part of how we're thinking about how to help people cut through the noise is just reframing the message. And then when you take that message and share that with President's Council members, and they can talk about what works for them or how are they active in their own communities or with their own families, So that's part of what we try to do, is think about where are we delivering those messages and who are they directed to, and then spending a lot of time testing that to make sure it does resonate. We're identifying the barriers that may be specific to different communities or different populations, addressing them, pointing them out, and then saying, here might be some solutions to work through that.
So there really is a lot of thought and science behind the messaging that you're doing intentionally for different people. And really, I'm taking from it, it's the actionable bite-sized pieces that people can implement in their daily lives, so that it's not, as you pointed out, exercise a really abstract concept or maybe a negative image, and that it makes it more approachable and friendly for people to be able to actually implement in their current lifestyles.
Definitely. And then other tips just for people when they're looking for that. I mean, that's what we are very intentional about, how we provide messaging. But I think to your earlier point, there's a wash with other information that isn't necessarily so intentional. And so really understanding the source of the message and, who is delivering it is really important, both for print, mass media, as well as social media. And then, headlines can be very, very catchy. And so really going beyond the headline, because those are not, when they're drafted, they're not intended to inform. It's, it's to catch the reader. And so sometimes the content of the information, if you were to read beyond it, is not conveyed in the headline itself. So those are just some easy tips, I think, for consumers when they're out there, trying to make the best sense of the messages that are, that they're seeing every day.
Yes, because it is challenging. And I think pointing towards your work, the department's work, the President's Council and the members of the council who are promoting, those are reliable sources of information that people can rely on as a great starting point. And you talk about, we'll say, physical activity. And I love the concept, which we're about with Kuul Play, is the movement aspect and broadening the definition of sport and trying to make it friendly and approachable. And when we look at kids specifically, we know we need to get more kids involved in sport. And it is pretty incredible that it was up until recently that, and you just mentioned it, Katrina, that we didn't have a federal roadmap on youth sports. And so that's really exciting that we now have that. And that's been a lot of your work, more recent work. Maybe you could share with how it's been implemented so far and how, where we're at with it.
Sure. So we were first asked to put together the National Youth Sports Strategy a few years ago. We actually launched that in 2019. It came off the heels of the second edition of the Physical Activity Guidelines for Americans. And so part of how that came about, we had just spent, it takes us about 4 or 5 years to develop federal policies. So we spent all this time looking at the science, particularly in kids, around that 60 minutes a day recommendation. And so we knew all of these benefits of regular physical activity in terms of bone health and muscle strengthening and kind of all of these healthy child development pieces. But we still have low rates of meeting the physical activity guidelines. And we know sports are one way that kids like to be active. But as we dove into that piece, there's some really big inequities in our country and really around the world in terms of who has that opportunity and access to play sports. And sports brings some more of those benefits beyond just the physical activity. You get the teamwork piece, the work ethic, some of those physical literacy skills that we forget about that we need to teach kids: how to throw a ball, how to kick, how to jump and hop and land properly, and some of those pieces. And so that's where we put together the National Youth Sports Strategy, pulling from other work that's already out there, a lot of work at the Aspen Institute, a lot of work of the National Physical Activity Plan, their sports sector. So taking all of these kind of best practices of how do we make sports fun and accessible. And then from there, we've been implementing that mainly through our NYSS Champions program. So the vision of the National Youth Sports Strategy is that one day all youth will have the opportunity, motivation, and access to play sports. And so along with that vision, we invited any organization that does work or supports youth sports to join us and be in partnership as we're collectively trying to reshape the youth sports landscape in the United States. So we have over 200 organizations that are now a part of NYSS Champions. We welcome anyone else whose work aligns with the vision. So we've got ranges from small youth programs themselves to academic institutions that are doing research in this space to foundations, kind of the gamut of different ones that we've brought together in partnership to learn from one another, to lift each other up, to put a spotlight on what's working, particularly for organizations that are focused more on these underserved populations. So when we talk about that, those are groups that have lower rates of participation compared to their peers. So that's girls, youth with a disability, youth that are living in more rural areas, lower income households. And so these are the populations, when we start looking at the numbers, that they aren't getting the same opportunity to access. And there's some great organizations that are specifically saying, we're going to focus in on here, and we're going to really think about how do we reimagine youth sports for these groups to make it more inclusive.
That's incredible, coordinating the efforts and highlighting the efforts and amplifying the impact. And I know that in that strategy, you've highlighted a number of areas, and one that was really highlighted when that was the role of schools and physical education, where kids spend a lot of their time developing the fundamentals and physical literacy. And it's really, I suppose, maybe often the first place that kids encounter even sports. And so maybe you could share with us maybe some of the actionable ways that you hope that the strategy will move the needle in the education space on this for kids and making it more inclusive and accessible.
Sure. Let me start, and then Rachel can talk more about the Presidential Youth Fitness Program and some legacy pieces of that we're working on, how we could reimagine that. But yes, schools are a great opportunity, mainly because most kids are there for a majority of their day. A big barrier to youth sports, it's not necessarily that kids don't want to, but a lot of times the cost, the time piece, and the transportation are some really big barriers. And so if we have opportunities within the school day, whether that's a before school program, something within the day, a physical activity break, PE, something after school where kids already are, or intramurals that are happening at the school, that's automatically removing some of the barriers because kids are already there. Things like physical education classes can really be wonderful ways to introduce some of these physical literacy skills, and then also introducing some of these sports in a safe way. So a kid might not be like, hey, mom, I want to sign up for lacrosse, because they have no idea where to start. But if they picked up a stick at a PE class and we're like, oh, this is how this might work, well, then they might have interest to go try it because they already got that starting point through the school system. So I think there's a lot of opportunities. I know there's a lot of things that are packed into the school day, but there's a lot of great data from an academic standpoint of the benefits of physical activity as well as sports. And so when there's opportunities to put that in the school day, you can see some of these academic pieces as well, and also then in an equitable way, bringing in the opportunities to be active for all kids.
Wow. And that sounds like physical activity and even sports, physical literacy. It's an untapped resource then, and that has broad implications. And so could you see, and you alluded to it, the school day is pretty packed, and I know educators find it challenging to fit everything in, and there's literacy and math and everything, but it does have ripple effects on that academic performance. Can you see us moving towards maybe more priority given towards maybe PE and the inclusion of greater amounts to reach the physical activity guidelines and in line with the strategy and the guidelines within that school time?
Sure. So we've got the history piece. I think Rachel can speak to this best of some ways that historically we've had it in there in a bigger way.
Yes. I think as you both alluded to, the school day is a wonderful opportunity. And there's been so much research showing that kids who are active are able to concentrate more on their academic components of school, having been able to get their bodies up and moving. And we have the President's Council historically has been a huge champion of physical education. We've had past chairs of the council go around, to each of the states to advocate and to really just speak about the importance of physical education in the school setting. And one of those programs that the President's Council has championed over the years is the Presidential Youth Fitness Program. The name has changed, as time has gone on, but it's a curriculum in the school setting that really empowers youth and motivates them to be physically active, and then has a fitness assessment component that is conducted in the school. But it's much more than just the physical assessment. It's really this goal setting that the students are able to do for themselves to track their own progress and to see how, as they develop these physical literacy skills, they are personally empowered. And so the program was designed to provide this curriculum and training for educators so that they could implement it in their setting. The program has languished over the years, and so it's a real priority right now, both from our office as well as the President's Council, to reimagine that program. Congress created a National Fitness Foundation in 2010 to support the President's Council. And so that the Presidential Youth Fitness Program has been organized and operated out of that foundation. And so it's really this exciting joint effort where we're working together to reimagine how we could have this program back in all schools across the country, to give that empowerment and just give educators a resource, a free resource, because that's a huge component of this program, is that it's free, so that educators can implement it within their school setting without additional resources.
And then that's back to your equitable piece and accessibility piece, and as it knits together, that's such a powerful program. And it's that collaborative piece in embedding it into within existing systems such as school, and to be able to reach people. And I suppose it's at, different states, different districts have different, and that's the challenge really. But something like that type of program really helps, I suppose, equalize or level the playing field, perhaps, maybe it sounds like a way to phrase it, and can be really supportive to the education sector in being able to embed this, and take the benefits for that apply to academia, but the benefits for the health and well-being of their student population.
Yeah, our goal is to reduce as many barriers as possible. As Katrina said, there are many, but we feel so strongly, from all of the science and the research that has been conducted about how beneficial this is for the next generation. Their physical health, their mental health. I mean, there's a lot of research that shows how being physically active can improve your overall mental well-being, and your other skills that Katrina alluded to as well, leadership, and just, being able to have that social cohesion and connection with your peers. All of that can be taught through physical activity and sport.
It's really incredible, the breadth of benefits and the importance. And I'm glad you brought it up, even for mental health. And that's a particular priority, after we've gone through some difficult years with COVID and everything. And you've touched on it between nutrition, mental health, that the importance of your work actually spans. It's not siloing any one aspect, it's recognizing the integration of all these, which I think is important to highlight to how you approach it. And that helps with the amplification of your impact as well, I would imagine.
Yes, it's definitely not a siloed. I mean, all of these components of health go hand in hand to build our overall well-being. And so you can't look at any one component in isolation. Having access to healthy food, having access to safe, places to be physically active benefits so much. And the mental health piece is just, it's a really important component, as you said, just in light of all of the things that our youth and adults as well have been grappling with over the last number of years. This is one tool in an arsenal of many, but it's a powerful tool.
For sure. And recently, the President's Council convened, and its new members were sworn in by the Department of Health and Human Services. And so, for those listeners maybe who may not be aware, could you tell us a little bit about maybe this occasion and the council members, and any priorities and goals that lie ahead? I think you've alluded to some in terms of the fitness program, but anything else you might be able to share?
Sure. So the President's Council, as I mentioned before, is the members are appointed by the President of the United States, and the Biden-Harris administration's slate of President's Council members were just sworn in June. And so they serve 2-year terms and have the opportunity to be reappointed. And they are established through an executive order, which is issued by the president, which outlines some of the priorities that each council, over their next tenure of time will be focusing on. And so priorities that this particular council will be focusing on is amplifying national awareness about the importance of physical activity and a healthy diet in terms of our overall mental health. That is definitely a number one priority of this council. Focusing on promotion of the National Youth Sports Strategy and just helping to amplify the benefits of children being active and participating in sports, and how we can make this opportunity more accessible to all. The Presidential Youth Fitness Program, as I just spoke about, is, and reimagining that and getting that back into schools is another priority. And then I would say another huge priority is to amplify messages and to help implement the national strategy on hunger, nutrition, and health. So that was a strategy that came out of a conference held by this administration last fall in September of 2022. And it sets out a call to action to all sectors to help reach this administration's goal of eliminating hunger and reducing diet-related diseases by improving physical activity as well as access to a healthy diet. And so the council will be very instrumental in helping to amplify messages and just think through opportunities to continue that call to action and to engage other sectors in helping us to realize the goals of this administration.
And it sounds like that this conference and the Biden administration, Harris administration's national strategy on hunger, nutrition, and health that you're mentioning, it sounds like that the physical activity component of that is really, really important, and that maximizing funding now across the strategy and beyond to optimize population health would be a key priority at this given moment in time.
Yes, it was recognized as, we were working to create this national strategy. There are 5 pillars of the strategy, one of which is increasing physical activity for all. Because, when you look at the data and you look at practice, you can't reduce diet-related diseases and chronic diseases, be it heart disease, obesity, diabetes, without dealing with physical activity. Physical activity and a healthy diet go hand in hand. And so it is really paramount to include them both together. So it was important to call that out, and we look forward to supporting it.
Well, it's hugely important, and what you're saying is we should be thinking about that co-investment in physical activity and nutrition so we can optimize those outcomes, and then it's synergies and economies of scale beyond that. Then, and in a large part from all the work and the programs that you've spoken about, you're very much focused on the prevention piece. So rather than, would we rather pay more on the back end of the problem as opposed to make more strategic investments now and invest into this and the interventions on the front end, that prevention piece, rather than firefighting the symptoms, and that seems to be where your work and your thoughtfulness and strategically being able to work towards the advancement of that. Would that be a fair?
Absolutely. I mean, if you think about the name of our office, it's the Office of Disease Prevention and Health Promotion. And so we know that the benefits of being active and eating a healthy diet up front can really set you up for a lifetime of being healthy. And so the more that we can do to kind of educate and empower and get kids to be active, such that it's just a normal part of their routine and what they're doing, and finding something that you enjoy doing so that you're moving your way every day. We think is a really important piece that can help set up our country really for success.
And then what strikes me from everything that you've both just said and spoken about is that particularly youth sport and physical activity and health, it affects everybody and every part of society. And so while your office is providing that leadership for a healthier America, I imagine it requires incredible and extensive collaborations within the department and other federal agencies, and even external partners that maybe, those of us outside of it, we don't recognize that or we don't see that. Maybe you could talk and speak to the level of effort and the teamwork that's required to really make impact and change really at scale that you're trying to do, and given the complexity of what we've just discussed.
Sure, I'll start on that piece, but yes, there is an extensive amount of coordination that happens. As we shared at the beginning, that our office is a part of the U.S. Department of Health and Human Services, which is a fairly large agency, includes CDC and NIH and the FDA. The Office of the Secretary is kind of where we sit. But when we put out federal guidelines, we're doing that on behalf of the U.S. Department of Health and Human Services, which means on a federal level, we are coordinating all of the pieces on the federal side to kind of make sure that we're in alignment, especially looking at the science and really the messages, because we really want to make sure that we're speaking with one voice. We know there's a lot of information out there and it can be confusing. And so part of why we do all of this coordination on the federal side is so that when something comes out as the guidelines, we're all on the same page about that. The same thing happens on nutrition when we talk about that coordination with HHS and the U.S. Department of Agriculture and connecting all of those pieces. And then from there, once we put out the guidelines, we actually have review committees that any agency that's making resources can go through the review and make sure, like, yes, we're describing this term in this way, the same way every time. If we're talking about sports sampling, this is how we're talking about this. This is how we're framing it so that there is some consistency. And then beyond that, there's a lot of coordination, of course, with external partners as well, because we want their help and assistance to amplify and to share that information. So I mentioned our Move Your Way communications campaign. There's over 80 resources in English and Spanish. These are federal resources that we have spent a lot of time and resources to create, to test, to make sure they resonate, and we want people to use them and take them. So if you're trying to communicate about this topics, and same thing as my plate on the nutrition side, like we would encourage you to take the resources that we have and use them, because we've set them up to resonate with different communities and different audiences, whether that's kids or parents or older adults. And part of why we work so hard to coordinate is that so we try to make sure there's less confusion when it's going out to the public and consumers, because it is a lot of work and it is hard to be active regularly and to eat a healthy diet and find accessible options. And so we see our role to help at least make it as easy as possible from a resource perspective to share that information.
That's incredible. And it's the ability to be able to resonate with people and to be able to translate. And it's the complexity, like you said, all the way from science, but the integration piece, there's a massive amount of work. This doesn't just come out of the sky, and it's not without rigorous review and consultation and input from lots and lots of different stakeholders, we'll say. And I can't help but think of the slogan as you're both talking that we frequently use in sports. If you can't see it, you can't be it. And so I think about, the importance of visibility, of your leadership roles for young girls and women, particularly in the space of sport, activity, and public health. And especially when we consider the participation rates that you talked about that are much lower for girls. And I'm wondering, how do you think about that as you carry out your roles in your positions?
I mean, it is definitely something I think, we both had different experiences just personally growing up with sports, and, how we message and how we give opportunities. We recognize the populations that Katrina laid out earlier that don't have as great of access. And so really being proactive to make sure we are messaging directly and helping to encourage. And I know from my own experience, I grew up, I focused more on dance, but as I got older, really wanted to have an opportunity kind of in that, when I got to high school and kind of that, school sport activity. And so having opportunities at all different levels of ability is tremendous. I mean, I was in a small school and was able to play on the school tennis team without having had a lot of prior experience, as well as the track team. And that was a tremendous experience, being able to have that without having a lot of background. And so, that's not always possible in larger schools when we have limited resources and fundings to go to, varsity sports, but having clubs or other intramural activities that encourage girls and individuals of all abilities to have that experience playing on a team, especially as they get older, when we tend to see that drop off, I think is just something to be very mindful of, and to think about how we create those opportunities in all communities so everyone has that opportunity, because it is very powerful.
Exactly. And I'll just add on, one of the strategies in the National Youth Sports Strategy is having coaches that reflect the demographics of that community. And so seeing positive female role models in particular. So the Women's World Cup is going on right now, and there's been a lot of talk about seeing that there's 3 women who are mothers on the U.S. national team. And so they signed the collective bargaining agreement last fall. And, in terms of pay, in terms of maternity leave, in terms of being able to bring a nanny with them and things like that. And I think the more we can do to spotlight that, women can be athletes, they can be mothers, they can play sports at all different levels. And I think the same is for any sport. And that's part of, I think, the benefit of introducing it young. And the way that so many sports now are shown on TV. We now see the Olympics and the Paralympics. We can watch all of them. And so I think that really shows people that no matter who you are, there's opportunities to play and find something that you enjoy doing.
And I'd like to also add the visibility that you both are providing in leadership roles within sport in a different capacity or within the health of the nation. And both of you are visible leaders for young girls who may be looking at getting involved in sometimes which can be sport or even exercise science or strength and conditioning can be maybe more male dominated, or we think of the elite sports teams. So I think I'd like to acknowledge your part as well in the can't see it, can't be it, maybe off the playing field and in your work and what you're doing for girls and as change agents. And I'd also then like to maybe push towards as change makers, innovators, with an eye to the future as you see it, what do you think we can expect the future to maybe hold for young girls, kids, physical activity, sport, given where we are now and maybe where we can go or could go?
So I think the future's bright. I think one thing kind of coming out of these last few years, the data hasn't been that good. We saw a lot of, lower rates of physical activity. We saw a lot of sports teams that stopped happening, that programs that had to shut down. And I think part of what the government does well, CDC, NIH in particular, of collecting some of this data so we know where we are. So one of the other components in our office is Healthy People 2030, which sets 10-year national targets for the nation. There's a number of physical activity and nutrition related ones. And part of what we're doing with that is setting these marks to say in the next 10 years, here's where we want to be. And so we've set some reasonable goals for us to be moving towards. And now we set all of these targets just before everything has happened. So some of them have gone the wrong way, youth sports in particular. We have some ground to make up. But I think we're having more of this national conversation and the acknowledgement of the importance of it. I think everything with the mental health crisis is really bringing to light, and there's some really great data that we didn't have several years ago of seeing the benefits. Our Surgeon General put out an article in May talking about the importance of physical activity for youth in particular around mental health. We have some really great data, and I think finding different reasons that might help motivate someone to be active. And I think feeling good now, sleeping better now, for an adult, maybe lower blood pressure, things like that, that kind of more of some of these acute benefits that we're now able to talk about versus in the past, we had a lot of benefits that this is going to prevent cardiovascular disease down the road and, reduce your risk for diabetes. That likely is not going to motivate someone to be active now. But I think this feeling better, the mental health piece, the academic piece, and some of these components that we now know more about, that hopefully we can think about how do we integrate physical activity into more of what we're doing, and how do we really ensure that everyone has access to healthy foods. And that's really underpinned everything that came out of the White House National Strategy on Hunger, Nutrition, and Health, and kind of this raising this acknowledgement of there's a lot of opportunities to do this better. There's a lot of disparities, and there's a lot of ways that we need to collectively work together as a nation to move the needle so that we all have the opportunity to live a healthy life.
And I would just add that the conversations taking place now at all levels, in local governments and state, level is just very encouraging. I think we have a long way to go, but I'm personally encouraged just about the amount of attention and the interest that, a lot of different sectors are now, giving to this, and the attention that they're providing and thinking through strategies that will resonate and will work in the communities in which they reside. So I feel very optimistic that we will realize the vision of the National Youth Sports Strategy and really helping, other communities just provide the access, both for physical activity as well as, healthy diet.
That's really encouraging, that optimism. And I know whenever I personally meet both of you, I feel that optimism. And it does sound like that out of the crisis we could call COVID, that may have set us back a little bit on some numbers, there is opportunity in that collaborative piece and the extra conversation. So the future is bright from your perspective. And so maybe I'll put this question to you. To shape that future, if you had a billboard, physical or digital, that could convey a message to the hundreds of millions, can you think of what you might put on that board?
That's a very interesting question. And I think there's so many different things resonate with different people. For me, I think it is just giving that intent that you can move your way and that you can do it anytime, anywhere. And so for me, I think I mentioned that I grew up, as a dancer. And so dancing kind of is something that I think is accessible to all people, regardless of their ability, regardless of their equipment, regardless of their age. So I might show an image of, a multi-generational group, dancing and just, moving your way and do it regularly.
We give kids the opportunity to ask questions to our guests. So maybe one or both of you might answer on this as you like. It's from Anna, age 9, and she asks, do you have to be born talented to be good at sports? And were you sporty as a kid?
That's a great question. So to the first question, do you have to be born talented? No, absolutely not. And that's part of kind of underpinning everything that we've talked about, that any person can be an athlete at any time and for at any age. And so, yes, there may be something sometimes you hear about, athletes that have parents that were athletes themselves. And so that probably means that if the parents were athletes, they were finding the opportunities for their child to do that. And so I would encourage kids of any age, to be trying activities and to be an athlete. I consider myself an athlete still now. And I know there's 75-year-olds that are still running races and themselves are athletes. And so I think that's a term that kind of transcends, the sport, the activity that you may be doing. The important thing is that you're finding ways to move. And yes, as a young kid, I was sporty. I did not go the dance route. Actually, interestingly, my mom signed me up for soccer because she said that looked like more fun to watch. So I was a soccer kid and played other sports in high school, learned about the benefits of cross training. And so I did some track and I did some lacrosse and some other activities. So mainly because my parents signed me up for things and I had the opportunity to play. And that's part of what we're trying to give everyone the opportunity to be an athlete and find something that they enjoy doing.
That's fantastic news for Anna, and great messages there. Some loads of gems. So we'll move to the rapid fire questions. And these are really one word, up to a sentence, short answers, if you're up for it.
Yeah.
Okay. So we'll have some fun here. So first one up, the best takeaway or piece of advice that you've received about staying active is?
Keep doing it.
Yeah. Keep going.
Yeah.
And that's kind of the move your way piece of find something you enjoy every day.
Love it. Okay. My favorite way to be active is?
Running.
Hiking.
Love them both. Okay. When you both think of someone who majorly influenced you in having an active lifestyle, who comes to mind?
My kids. I want to make sure that they have as many opportunities, and so they keep me accountable.
I was going to say coaches, and then hearing Rachel's, I think that piece too. My son came downstairs while I was working out this morning and sat there and watched. And I was like, do you want to do something else? And he sat there and watched me work out. And I was like, this is an awesome opportunity for him to just see this and hopefully continue to be active himself.
That's a golden moment. Wow. Okay. These are getting harder to top each time. Okay. Sport is?
Fun.
Rewarding. Sport is rewarding.
Ooh, good. My happiest moment from youth sports is?
Mine's being able to play on the tennis team in high school.
My soccer team won the U18 title and won the state championship on my 18th birthday. And that is a forever moment and a forever day.
That's incredible. And it's both interesting, isn't it, what resonates with us, the different happy moments, the level of significance. That's really cool. Okay, if people knew what you both know, what way might they support or coach their kids?
Oh, this is a great one because there's a lot of coaches that put a lot of pressure on kids, coaches and parents themselves. And I think this is not a one-word answer, I apologize. We've missed the opportunity to make sure that there is a fun component. When you ask kids why they play sports, their number one reason is fun. When you ask parents, fun is way down on that list. And so we need to really make sure that they are enjoying this opportunity and that these are ways to be fun. Sports are hard, and sometimes there's there's losses and there's things that don't work out. But at the end of the day, when the kid comes off the field or off the court, did you have fun? Not did you miss that pass or what happened here? Did you enjoy it?
And letting them try different things, because not the first sport a kid tries may not be the sport they enjoy. And so you have to give them opportunities to find what they like.
Beautiful. The power of youth being active is?
They're our future.
Yeah. And if you started as a kid, I joke that I brainwash my children, but I kind of do, that if they can see the benefits physically, mentally, socially of being active, then ideally that sets them up for an active lifestyle. Because for me, being active is just part of the day. I find a way to put it in. It might be 5 minutes, it might be 30 minutes. But if we can help our kids find the enjoyment and the fun in doing it, then hopefully they'll continue.
Yes, in that powerful neuroplastic phase of childhood when it's so important. Yeah. Absolutely. Why does doing right by kids in youth sport and health really matter to you?
I think that's my same answer, that they're our future. We want all youth to have opportunities, and it is our job as the adults to make sure that they have those opportunities.
And I'll just add our jobs too, to make sure that they're safe opportunities for kids. And so going back to what I was sharing about kind of making it fun and thinking about how are coaches coaching? What are the messages that we're sending? And are we putting our kids into environments where they're going to be safe? I see that as our role, from the government perspective, but also kind of as parents to help ensure that we're setting up those opportunities for our youth.
Right. So rich. This has been so rich. We have our final question, our final rapid fire question. My vision is
that one day all youth will have the opportunity, motivation. Oh my God, I just blanked. All right, we'll restart that one. That one day all youth will have the opportunity, motivation, and access to play sports.
Yeah, and mine is just that every individual recognizes how important being physically active and eating a healthy diet is to them, and then making sure that environments provide that opportunity, that it's affordable, accessible, and safe.
And on that note, I think that's a mic drop. You both stuck the landing on that one. Where can we point folks? You mentioned a lot of different areas that you are providing information. Where can we point them to find that quality information and access your free resources?
So everything that comes out of our office is at health.gov, which is our website. And so that has information on the dietary guidelines, the physical activity guidelines, the National Sports Strategy, all of the work on the President's Council on Sports, Fitness, and Nutrition, Healthy People 2030, which I mentioned, that is tracking all of this data. It's a wealth of information of all of the resources and tools that you can download and use, and also follow along with the process. I mentioned the dietary guidelines work is underway. There's also an open public comment period. So we want to hear from individuals. And we do that every time that we have work to develop guidelines. We open up public comments and ask for input into that process as they're reviewing the science. So.
Fantastic. Rachel, Katrina, this has been a joy. I loved having this conversation with you. I hope we can do more. And so before I sign off, I would just really like to acknowledge you both for all your contributions, your continued impact in shaping the landscape of physical activity, sport for the nation's youth. So thank you both for this incredibly important work and the part you play in leading a giant symphony of impactful change and building a healthier America. So thank you for your time.
Thank you so much for having us. We really appreciate it.